Hello, my name's Professor Peter Nash from School of Medicine, Griffith University, beautiful downtown Brisbane in Australia, reporting from ACR Convergence in San Diego. And continuing the Apremilast theme, there's abstract 1414, which pools patients who lasted 52 weeks in the PALACE 1-4 and the active study and examined their cardiometabolic effects of Apremilast over that length of time. Now, we are very well aware of the cardiometabolic risks of psoriatic arthritis. These patients have premature atherosclerosis, poorly controlled inflammation drives that disease. They often have metabolic syndrome, overweight, drink too much, abnormal liver function tests, fatty liver, etc. Hyperuricemia, gout. So the cardiometabolic effects are important, and any therapy that might improve that is certainly worthwhile taking a look at. At ULA Milan, they showed a very nice study of the new weight loss drugs, Ozempic and Wegovy, in a cohort of patients who were diabetic and also had autoimmune disease, and they looked 10,000 patients with that combination and showed you could reduce deaths, strokes and heart attacks. So what does Apremilast do for these cardiometabolic issues? Well, they looked at patients and they pooled them, and they had 780 odd patients who lasted 52 weeks, and they were able to show that 10% who were obese and overweight, they could reduce them from the obese over 30 BMI down to the overweight, and those patients who are overweight, that's a BMI between 25 and 30, 12% could be reduced into the normal range when you just looked at weight loss by itself. You could show reductions in LDL. You could show, particularly in those with the highest elevations of LDL. And if you looked at the pre-diabetic population, that is HbA1c between 5.7% and 6.5%, 50% of those patients could be reduced from pre-diabetes to normal. And if you looked at the frankly diabetic patients who had a hemoglobin A1c of over 6.5%, 40% could be reduced from frank diabetes to pre-diabetes. And these results were consistent across different disease activity measures. So here's a medication that works for joints in particular, but also for skin. It's quite safe to the extent where monitoring is not required, and it's able to improve important parameters of cardiometabolic risk, in particular LDL, weight, and hemoglobin A1c. So we look forward to this panning out in bigger studies, prospective studies, but at least a plus for this particular agent in treating your patients with psoriatic arthritis. Thanks for your attention.